Thank you to Linda, Ellen, members of the ADAO Administration and Scientific Advisory Board, and to the guests and attendees for inviting me to speak and listening to this talk today. As with all public talks, I note that I have no financial disclosures, but I confess with pride that I work at Mount Sinai, home of the Selikoff Center, and the center where Irving Selikoff first discovered the relationship between asbestos and cancer. Linda asked me to speak about a topic near and dear to me, that of taking care of patients with mesothelioma and other asbestos-related disease. Diagnosing pleural mesothelioma can be tricky as symptoms develop insidiously and progress slowly sometimes. Here is a chest CT that was done on a man who had worked in the shipyards as a youngster who presented with shortness of breath. This gray stuff in the corner is fluid between the rib cage and the lung called pleural effusion that later proved to be the result of diffuse pleural mesothelioma. Linda and the folks at the ADAO can tell you they routinely field emails, calls, and other contact from people affected by asbestos. This includes not only patients and caregivers for people with asbestos-related diseases, but also those with exposure to asbestos who have not yet been diagnosed or who have not yet suffered. We currently do not have good screening tests for pleural mesothelioma or other asbestos-related diseases. Baseline chest CT and breathing function tests can be helpful, though. Regular medical care is very important. And providers need to have a high index of suspicion in patients with asbestos exposure for symptoms like shortness of breath or chest pain. This is not meant to instill panic or fear in an asbestos victim, but rather to inform, arm, and empower you to get ahead of this. There is a 20 to 40-year latency period between exposure to asbestos and development of mesothelioma. You need to have a plan for regular medical care, and clinicians need to pay attention and listen to patients who've been exposed to asbestos. Early diagnosis is key. This requires that a patient report their symptoms. Don't blow off your symptoms as being related to getting older, and don't keep them to yourself. Tell your doctor. And clinicians, you need to ask the right questions. You need to take a thorough history about environmental and occupational exposures. You need to listen carefully and understand your patient's symptoms, what they are, and the cadence of how they developed over time. If you have been diagnosed with mesothelioma or another asbestos-related disease, we encourage you to seek opinions from a center with expertise. For example, I created the New York Mesothelioma Program at Mount Sinai with the purpose of providing holistic care to patients with this devastating asbestos-related disease. Here is our team receiving the International Association for the Study on Lung Cancer 2021 Team Cancer Care Award at the World Conference on Lung Cancer. We see patients in our multidisciplinary mesothelioma clinic. I'm the surgeon, Dr. Christian Rolfo is the medical oncologist, and Dr. Ken Rosenzweig is the radiation oncologist. We offer onco-general medicine services, onco-cardiology, palliative care, and social supports, in addition to the opportunity to enroll in clinical trials. We are currently near completion for accrual of an exciting trial evaluating the benefit of a synthetic vaccine called poly-ICLC in patients with mesothelioma who are candidates for surgery. Eligible patients undergo biopsy and injection of poly-ICLC into their tumor, followed by a surgical resection 2 to 4 weeks later. We have found that treatment is well tolerated and safe. We're currently analyzing the data and following for long-term results to determine the potential benefit in delaying progression or recurrence of mesothelioma, and ideally prolonging survival in these patients. While we are still conducting the study and analyzing our results, we are encouraged by what we are seeing. This is a patient who underwent injection of poly-ICLC into his pleural tumor in the chest around the time of this first PET CT. He developed an intercurrent illness and could not undergo surgery. He therefore received chemotherapy, and 6 months after treatment, not only did we see response in the pleural tumor in his chest, but also the disappearance of a liver metastasis. We have never seen this kind of response in chemotherapy alone or any treatment alone. It suggests to us that there may be an effect on the immune system that the vaccine injected in the tumor causes that seeks out other sites of disease, called an abscopal effect. And either it attacks the metastasis directly or facilitates response to therapy in those areas. While we're excited by these preliminary findings, the key is early diagnosis. And early diagnosis of asbestos-related disease can help minimize patient suffering and maximize their chance of survival. For example, that first patient, the shipyard worker with the pleural effusion, was ultimately found to have early-stage pleural mesothelioma, the kind that did not invade the lung and was able to undergo resection by pleurectomy decortication. This is another patient who had pleurectomy decortication, which involves removal of the tumor from the lining of the chest wall and the lining of the lung, as well as the sac around the heart called the pericardium and the surface of the diaphragm, the muscle that separates the chest and the abdomen. If the tumor does not invade the lung, you can resect a lot of disease this way, like entire Kentucky Fried Chicken buckets worth. This is pleural tumor that was removed from that other patient. That is, if the tumor does not invade the lung. Here is a chest CT from that first patient, disease-free 3 years later. On the other hand, this is a 47-year-old man who was exposed to asbestos while working as a mechanic with brakes. His disease took years to diagnose, and by the time we met him, the tumor had caused contraction or narrowing of his chest wall, and it had invaded his lung. To remove his tumor, we had to remove not only the pleural tumor, the lining of the lung and the chest wall, but also a portion of the sac around his heart and the muscle that separates the chest from the abdomen, the diaphragm. That's called an extrapleural pneumonectomy, or EPP. Here's that patient's tumor. You can see the lung itself with the pleural tumor, a portion of the sac around the heart called the pericardium, and that muscle of the diaphragm. And this is his chest CT 1 year later, showing no recurrence of his mesothelioma, but also no left lung. He is alive now 9 years following surgery. So arm yourself, establish a game plan, and ask questions. Seek first or second opinions from centers with expertise in mesothelioma and asbestos-related disease. Don't be afraid to speak up. Question your treatment providers. And most importantly, for as long as you feel well, you are well, and we will fight with you by your side. I thank you for your time. This is my favorite strong survivor wearing his Only the Strong Survive shirt, representing both his superhero status and his favorite artist's latest album and tour.